Hi, I'm Alexis Duco. This is my father, Les. He will be my patient today for my clinical bedside swallow evaluation. I have my gloves on as a universal precaution, and so we're going to go ahead and get started. I'm going to start by looking at the structures in his mouth. Okay, thank you for opening. Okay, so right now I'm looking for your tongue, hard and soft palate. I'm just going to press down here. I see your fascial pillars, and then I'm going to look over here at your anterior and lateral sockeye. Looks good. Okay, and I'm just going to look at your tongue. Looks normal. Okay, you can go ahead and close your mouth. Neck looks normal, no scarring, and it looks like you have most of your teeth, all your real teeth are there, right? There's no dentures.
Right.
Okay, that's good. Okay, next I'm going to ask you to do some things with your jaw. First, can you just open and close your mouth? Okay, very good. And then I'm going to ask you to just move it side to side and just make sure you're moving your jaw. Okay, and I'm going to put my hand there and just push. Okay, and then move it forward. Yep, and push. Okay, very good. Okay, now I'm going to ask you to push your lips together. Okay, and then looks good. Go ahead and open. I'm going to put the tongue depressor between your lips, and then I want you to hold down as tight as you can, and I'll try to pull it out, okay? Okay, good work. Good lip seal. Okay, I'm going to ask you to first put your tongue out, so just stick your tongue out, and then can you move it up and down? Okay, perfect. And then I'm going to put my hand on your cheek, and will you just use your tongue to push against it? Okay, and I'm going to do the other side. Good, one more time on that side. Okay, very good. Very strong. And okay, and next I'm going to have you use your tongue to push from the front of your teeth to the back of your mouth like you're clearing peanut butter off of your tongue. Go ahead and do that one more time. Okay, looks good. Very good. Okay, the next thing that, oh, and then I'm going to have you inside of your mouth, lift your tongue to the roof of your mouth and lower it. And just keep it inside your mouth on this part though. Yep, very good. Okay, wonderful. Alright, so for the next part I'm going to have you say some sounds. So the first sound you're going to say is pa 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 pa. Okay, good. The next sound you'll say is ta 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 ta. Okay, good job. And then the last sound is ka 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 ka. Okay, good job. Now you're going to put all three of those sounds together, so you'll say patika 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 as fast as you can.
Patika 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 patika.
Good job. Okay, that sounds great. Okay, I'm going to now check your soft palate function. So what I'll need you to do is say ah 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 ah, and what I'm just looking for is in the back of your mouth to see if your soft palate is lifting up equally at the same time. So go ahead. Okay, hold on. Use your tongue. Just Okay, that looks good. Okay, I'm gonna have to check your gag reflex. So I'm just gonna move the tongue back slowly, and as soon as I see that you have that, I'll just move it out. Okay, very good. Thank you. Sorry about that. I know that's uncomfortable. Okay, oral sensitivity. I'm going to just touch your mouth. I'll use my my gloved hand, and then I just need you to point to the side of your mouth that I'm touching. Okay. Where I guess actually I think I should touch inside of your mouth. So I'll use the stick to touch inside, and you just use your hand to tell me which side I'm touching on. Okay. All right. Go ahead and put it down. I'm gonna do here. Just put both hands down. I'm gonna do on your cheek. Okay. Yes. Okay. Wonderful. Okay, and next I'm going to ask you to just do the ah sound for as long as you can. So you just say ah. Go ahead. Okay, that's good. Perfectly normal. Okay, and then the next I'm going to have you do is a pitch change. So you'll just do start at a low pitch. Ah. Okay, perfect. And then you'll start high and go low. So ah. Okay, let's try that one more time. Ah. Okay, that sounded much better. Okay, and I just want you to do a cough, like you have something in your throat that you want to get out, nice and strong. Oh, Oh, that was a good one. And then go ahead and clear your throat. Good, good, good. Okay, and I'm going to have you just swallow without anything in your mouth. I'm going to put my hands on your neck so I can just feel your swallow, okay?
Okay.
All right, go ahead when you're ready. Okay, one more time. Okay, good job. That was perfect. Okay, so now I'm going to have you try some liquid for me. Okay, and so we'll first start with just a small tablespoon. Okay, we'll first start with a small tablespoon and then we'll work our way up. After each trial, I'm going to ask you to just say, ah, and then I'll look in your mouth to make sure everything is clear and none is in your vocal folds. So we'll just start with a half of a teaspoon on this one, just using water on this trial. Okay. And you know, actually, I'm going to have you just do it one more time because I was not ready to feel that swallow. Okay. Go ahead. Okay, good. And then we move to a little bit of a larger amount. Tricky. Okay. Okay, everything normal there. Will you go ahead and just say ah?
Ah.
Okay, normal. All right, I'm gonna have you just take a short sip. 1, 2, 3, stop. Oh, I keep forgetting to. Okay, and then take one more sip. 1, 2, 3, stop, and then go ahead and swallow immediately. Okay, normal swallow there. Okay, and then the last part of this trial is just you'll be able to self-regulate. So you take as big of a sip of that as you feel comfortable with, and I'll. Okay, perfect swallow. Thank you. Okay, and then we're going to move on to puree, which is we're using applesauce for that. So again, we'll start with a small amount here. Okay, that's probably good. Okay, and then you go ahead. Okay, good.
Good.
And then just say ah.
Ah.
Okay, good. No residue. And we'll do a little larger amount here. Okay. Ready? Okay. Good. Alright, one more. I'm gonna do a heaping spoon, and then I'll let you choose the amount on your own, okay? Oh, I'm sorry. Okay. Good, and then go ahead and say ah.
Ah.
Okay, normal and no residue. And then I'll go ahead and give you the spoon, and you can choose the amount for yourself. And sorry, I'll just one more time. Okay. Good job. And then go ahead and just say ah again.
Ah.
Okay, good. All right, so we're gonna move on now to mechanical soft, and have some pancake here for that. So we'll start with a small amount. For this part, I don't need you to say ah. I just need to look and see if there's any residue left in your mouth. Okay.
Okay.
All right. So here's the first bite. Okay. Good job. And then let me just look to see. Okay, a little bit of residue on the lateral sockeye here on the right, but everything else is clear. Good job. Do you need any water to wash that down with?
Yeah.
Okay. And I will give you a little bit larger bite here.
Yeah.
Okay. Okay, and let me just check. Okay, a little residue on the tongue, but it looks pretty normal. Okay, good job. And there's some water if you want it. And then I will let you choose a bite here for yourself to eat. Okay.
Ready?
Yep. I'll just look. Yep, so a little residue on your tongue. You can maybe wash out with a little water. Looks good. Okay, and then we have just one last trial to do. We'll use a cookie for this one. Okay, I'm just gonna break this into pieces that are about the size I need. So we'll do small, and then you can regulate. Okay, did you get a drink?
Yeah.
Okay. Alright, so here's the first one. Chocolate chip cookie there. I'll just okay, good. And let's just check. Yep, absolutely clean. Perfect. Let me check. I'm sorry, I'm gonna just check over there. Yep, perfect. Okay. Do you need some water before the next bite? Okay, a little bit larger bite there. Okay, that was a good swallow. Let's just check. Just a little bit of residue on the tongue, but otherwise clear. Okay, I'm gonna go ahead. Yep, go ahead and have a drink before we go on. Okay, and then I'll let you go ahead and choose the portion for yourself. I'll just check one last time for any residue. Just a little left on the tongue, and I think it's because you are trying to chew quickly. Looks good. Why don't you go ahead and finish up with a drink? Everything looks pretty good. Thank you.